Hi everyone, my name is Jackie and I'm a family nurse practitioner and one of the instructors here at SMNP Reviews. I've worked in a few different settings as a nurse practitioner, and in this video I'm going to walk you through what a typical day was like for me in a long-term care facility. I worked in long-term care for just over 4 years and I found it immensely rewarding. If you have a passion for caring for older adults or just want to hear about an NP opportunity outside of a traditional outpatient clinic, then this video will be super helpful. And go ahead and click that subscribe button so that you can continue to stay up to date on all of our latest videos. So why did I choose to work in long-term care? That was such a frequent question I was asked. I think nursing homes or skilled nursing facilities get a bad reputation of being depressing, but I found it as an opportunity to care for some of our most vulnerable. Older adults all have a beautiful story to tell, and it is a great privilege to be able to care for them. When I was going through NP school, my end goal was always to work in a long-term care facility. As an RN in a rural hospital, I often cared for older adults and wanted to continue caring for them as a nurse practitioner. After a few years as an NP working in a family practice, I transitioned to a skilled nursing center. First, let me explain the difference between a long-term care center and a skilled nursing facility. A long-term care center is what is traditionally known as a nursing home. That means a permanent place of residence for adults who are unable to care for themselves. They may be completely dependent on care with severe limitations in mobility or cannot care for themselves due to cognitive impairments. Caring for these patients involves a lot of chronic disease management as well as psychosocial and palliative care. In contrast, think of skilled nursing facilities as rehab centers. These patients may be recovering from major surgery or illness and need help with that transition from hospital to home. These patients will be receiving services like wound care, physical, occupational, and speech therapy, and tend to require subacute management of conditions. So, for example, I cared for many patients that were recovering from prolonged hospitalizations, so I would help to manage any concerns related to that hospitalization while bridging that transition to get them back home. I worked in a long-term care facility that had units for skilled nursing patients. That means I had the opportunity to work with so many different specialties in healthcare. I helped to coordinate patient care between physicians, nursing staff, therapists, pharmacists, social workers, and administrators. I always felt like I had someone that I could reach out to and discuss things with to make sure that the patients received the care that they needed. So let me walk you through a typical day seeing patients in the facility. First, I would ask the nursing staff to write down patients on my schedule as any issues or concerns arose during the week. I would usually round once or twice a week, and there was always a physician on call for emergent issues. But since the staff knew I would be coming on certain days of the week, they would prepare a list of acute visits based on patient needs. I also had a list of new admissions, follow-up visits, as well as monthly and yearly exams needed for different insurance regulations. The facilities I worked in had an average census of around 100 to 120 patients, and I would usually see about 12 to 15 patients on the days that I rounded. That may not sound like a lot of visits, but these patients normally had very complex medical histories and conditions. Once I had my list, I would go see my patients, and then after that I would discuss plans with the staff and begin to chart and enter orders. I did a lot of managing chronic conditions like heart failure, chronic kidney disease, diabetes, and dementia. I also did a lot of phone calls and meetings with family members to update them on care, and sometimes even had difficult conversations when their loved ones started to decline. But I also found this work very rewarding. I loved coming back every week and making connections with the patients and seeing the difference I got to make for them. And so the biggest thing I loved about this job was the patients. I always found it to be a privilege to care for older adults, and I really enjoyed creating a bond with them. I also really enjoyed the complexity of the care. Chronic disease management can be tough because you really have to think about how all the medications and treatments will affect each body system. I was always reviewing kidney function, looking up drug interactions and side effects because of multiple prescriptions, and coordinating care between specialists. But I loved it. A common question I get asked is, can I work in long-term care as an FNP or do I need a different certification? The answer is yes. But we always recommend carefully reviewing the job description and the scope of practice for NPs in your state. In my positions, I was not doing any invasive procedures or monitoring, including any IV medications or high-risk management. There are some skilled nursing facilities that care for patients that are higher acuity, which in that case would have been outside of my scope of practice. Also, while you can certainly work in a skilled nursing facility right after graduation from NP school, I will say that the 2 years in family practice gave me a great foundation in chronic disease management. Also, if possible, I would highly recommend trying to complete some clinical hours for your program in a long-term care or skilled nursing facility if you can. That way, you can explore your interests as well as gain valuable training and experience. I hope you found this video helpful and that it provided more information about a rewarding career path as an NP. If you're interested in learning more about different topics pertinent to board prep and clinical practice, definitely check out our review courses. And if you want to join a wonderful free community of students prepping just like you, make sure you join our Facebook page. You are so close to becoming a real deal NP. Make sure you check out our other videos. And we believe with the right preparation, you can absolutely pass your boards. We are all rooting for you here at SMNP Reviews.